So before we discuss stem cells, let's discuss first what is aging. So, technically speaking, when you say aging, it is the cellular degradation accelerated by toxins, radiation exposure, microplastics, oxidants, etc. It is basically the oxidation of the cells. And whenever the damage outweighs the repair, that is when we age. So you might be asking, what are the toxins that causes cellular degradation? You might be saying, you're probably not exposed to these toxins. Well, if you ate rice today or yesterday, you were actually exposed to toxins already, because rice has toxins. Peanut butter has toxins, corn has toxins. So like peanut and corn, they have aflatoxins. And the other food that we eat almost contain all toxins. So if you eat the same food almost every day, they get accumulate in the body and they eventually cause problems. Microplastics, of course, if you eat fish today or any seafood, there's no more water in the world that is safe from microplastics. So all of those cause aging. So what's our goal? Our goal is right now not to live forever. Our goal is to age gracefully. What we want is, we want to be able to get to the point that we are going to live a full life and then eventually maximize our life rather than being sedentary or bedridden on the final years of our life. As far as the statistics go, the World Health Organization estimates that more than 600 million people are aged above 60. And it is estimated that this number will reach 2 billion by 2050. The reason for that is because there's a lot of supplements that are being developed, a lot of medical treatments that are being done that are lengthening the lives of people. And because of that, the aging population will be around 2 billion by 2050. So there are different types of aging. The first one of the three, is the anti-aging for the appearance. So which means that our appearance ages, our skin deteriorates, our body, our bone deteriorates. So that's the first type of aging. So whenever we talk about anti-aging, we address three types of aging. First is the appearance, and then the second is the aging due to medical conditions. So we already discussed one of the problems with sugar is it oxidizes cells. So if you have a medical condition like diabetes, like that, it accelerates your aging process. And lastly, the aging that causes death. So these are the three kinds of aging. Causes aging of the appearance, from medical conditions, and also the ones that will eventually cause death. So in order for us to address these ones, we need to be able to address the three kinds of anti-aging. So the question that most patients would ask us is, how can we slow or stop aging if it's possible? I'm not sure if it's obvious here, but there's a picture of Windsor Castle. So Windsor Castle is already in existence for years and years already, hundreds of years. And when you go to Windsor Castle, you'll see that it still looks nice, even inside. The reason for that is because, of course, environment, any typhoon, any earthquakes, it weakens the castle. It ages the castle. However, the government pays for a lot of the repair of the castle. So, what causes aging? When your damage is more than your repair, then we age. When your repair is more than the damage, then you don't basically age, right? To give you an idea, whenever we are born, of course it's different per patient. From the time that we are born, we have a lot of stem cells in our body circulating, so they repair our body. They keep on repairing all the way up till the age of around 30 years old. So after the age of 30, if you look at it, we didn't get old. We matured. From 0 to 30, we usually mature, right? We're developing. After the age of 30, that's when we get old. Because the number of stem cells or the repair cells is now less. There's less repair than the amount of damage happening in our body. So that's why we get old. If there's more repair, then we don't get old. So what are stem cells? Stem cells are the cells that were found that they had this unique ability to renew themselves through mitotic cell division and differentiating into a wide range of specialized cell types. To simplify, these are cells circulating in our bloodstream that when they see a damaged cell, the cell will now see the damaged cell, attach to the damaged cell, replace the damaged cell, and split into the existing stem cell. It will again look for another cell to repair. So you might be asking if this is the characteristic of a stem cell, that it will attach to a damaged cell and then split into the stem cell and leave the repaired cell. Why do we run out of stem cells? Well, the reason is because it's like a photocopy of a photocopy of a photocopy. Eventually, it gets weaker and weaker. The estimated time cycle of replication of a stem cell is usually around 5 to 7 times. Usually on the 8th cycle of its repair, it becomes faulty already. The DNA of the stem cell becomes damaged, therefore creating already potential cancer cells. If your immune system is strong, then it will see the damaged DNA and kill it. It will not become a cancer. If your body is weak, if your immune system is weak, then that damaged stem cell becomes your cancer cell. So now there are different kinds of stem cells. The two major groups would be, of course, your embryonic and your adult stem cells. Embryonic means that they were actually found during an embryonic stage, before the organism is born. So before we were born, our cells were embryonic. When we were already born, these are now what we call adult stem cells. So let's deal first with embryonic stem cells. Embryonic stem cells are the most controversial stem cells. The FDA restricts the use in people. However, they have the most potential for correcting and curing certain conditions due to their plasticity and ability to morph into many cell types. The only problem with them is that they are so good that they are like wild horses, very hard to domesticate, and they have the potential also of turning into cancer cells. But when it comes to potency, embryonic stem cells actually are the best ones. So there are problems with your embryonic stem cells. Number one is that if the patient gets an embryonic stem cell treatment, the patient can inherit and potential diseases that the embryo had, you might be able to get it also. There is also a significant potential that the cells can grow unchecked and essentially act as a tumor or a cancer cell. And of course, your immunogenic factors, that the body might attack it because it might be considered as a foreign body. So those are the problems. Currently, there's a lot of embryonic stem cell research that is happening, done in the world, and they have a lot of financial backing. The only problem is that up to now, they're not able to control the growth of the embryonic stem cells. So they're like a double-edged sword. So now we go to the adult stem cells or the mesenchymal stem cells. The mesenchymal stem cells are the cells that repair muscle, bones, cartilage, and tendons. They are commonly called as the adult stem cells. And when you say autologous, it means that they came from the same patient, which means that there's no risk of genetic disease transmission. You take it from the same patient and you put it back to the same patient. Basically, the mesenchymal stem cells are the body's own repairmen. They repair. So we discussed about the risk of using your embryonic stem cells. However, the question might be, are there risks in using mesenchymal stem cells? Well, there is, but of course, it's much, much less than your embryonic. The reason for that is because you're using your patient's own stem cells, which means that there's minimal risk to the patient. And as of 2009, there are over 7,000 studies that were done proving its efficacy and safety. The FDA also says that as long as the cells are from the same patient, taken from the same patient on the same day with minimal manipulation, then it is actually deemed as safe. It would be like getting a skin graft from your thigh transferring to the face. So it's the same. So where do mesenchymal stem cells come from? They are from, of course, your circulating blood, from your bloodstream. The only problem is there's not too many of those, especially after the age of 30, because we used up most of those stem cells already. Second would be from your bone marrow. The problem with the bone marrow is that you're robbing your future self because you need your bone marrow usually on your age of 50s and 60s. You need more of that because it also gets depleted. And the last one would be, of course, from your fat cells, especially from the lower abdomen. The reason why, if you want to understand that fat cells have a lot of stem cells, have you ever heard of a disease of the fat? Right? There's not much diseases of the fat that we have heard of. And we all know that you eat a little bit, the fat cells grow so fast. Even boxers, right? Even Manny Pacquiao, whenever he goes into a fight, he doesn't say, oh, my fat is damaged, right? Because they repair so fast. The reason for that is it was found that the stem cells in the fat cells are very, very abundant. There's so many. And the advantage of that is also, we will not miss if we will actually lose some of the fat cells. Some people might even want to donate. So why are we going to use fat cells? No, we're slowly simplifying things. No? The answer there is because there is an unlikely risk of getting problems. It is also a single procedure, very easy to do. It is well accepted in so many countries, and so many regulations are actually exempting it because it is nothing different than you doing your skin graft from your one part of your body to another part of your body. So what is being done is we are only getting the stem cells from the fat that is actually trapped into the fat tissue, and we're going to put that into the bloodstream. Actually, that's one of the most common questions that I get whenever I talk, because they say, why do you have to do anything? Apparently, we have stem cells in our fat. Why do you have to do anything with the stem cell? The reason is because those stem cells were allotted for the fat. So we have stem cells for muscle, for the teeth, for the bones, for the hair shaft, for the hair follicle. They all have stem cells, right? However, they need to be mobilized, they need to move in order for them to be able to treat problems. They need to go to the bloodstream. If your stem cell is only trapped into your muscle, then it is only for your muscle. If your muscle gets damaged, then it will only fix the muscle that is beside it. If your stem cell is trapped in your fat, then it is only meant for the fat. It will only repair the fat when it gets damaged. So you need to get it isolate it, put it into the bloodstream in order for it to look for problems. And of course, if we're gonna get the stem cells from your muscle, then you won't be able to walk, right? For example, if you get it from your leg, then you cannot walk anymore. If you're getting it from your skin, you need to get a lot of skin. So, usually if you get it from the fat, we might not miss it. So, more than 1.6 billion people are actually overweight, and 400 million of which are considered obese. So, using a treatment that costs between 2 to 8% of the world's total health expenses is going to be able to treat a lot of problems and solve a lot of issues in the world. So basically, you're solving two problems, obesity and also chronic diseases, when you're using the fat. And also, it's not only because you're not gonna miss the fat stem cell. It's also because from studies of all of the adult stem cells, the adipose stem cells are found to be the richest source of stem cells in the body. Which means that even if you compare it with your muscle, with your skin, with your hair shaft, with your tooth, the fat stem cells are still the most abundant and highest concentration. For example, if you're going to get your tooth just to get your stem cell, then you lose your teeth also, right? So, but fat cells, you're not going to miss it. Just to give you a comparison between the fat cells and bone marrow concentration, the one on your left is the bone marrow stem cells. Per volume of fat and bone marrow, that is what you get. And the fat cells would be the one on the right. It's very, very highly concentrated. So some people are usually curious, how do you collect the fat cells, which then become your stem cells? So let's simplify the procedure. Of course, it's more technical than what we're going to discuss. There's so many steps. But let's group it into 4 steps. First one is by doing a lipoharvest. It's similar to doing a liposuction, but you're not throwing out the fat. You're not using a suction machine to throw out the fat. You're basically extracting fat. The principle is similar, but not the same. So after you get the fat, you have to break down the cells because stem cells are still trapped in between your fat cells. And there are blood, tissues, collagen, so many other things that are around your fat cells. So you need to break down. So this is a series of procedure that you do. Procedure is around 3 hours to do the breakdown of the cells. And then after you break down the cells, you need to separate the stem cells. And lastly, the enhancement. So stem cells on their own are really strong. They can already repair problems. However, there are new methods of activating the stem cells, making them stronger. And one of those is by the use of lasers. They actually found that there are certain wavelengths of lasers that activate the stem cells. And the studies actually prove it. Now, question of some patients is, you mean you really need to have the laser to activate the stem cells for them to work? Not really. It only means that if you activate it with the laser, the stem cells are more active. They can treat problems sooner than if you're going to wait longer without activating it. Okay, so we've been talking about stem cells, right? But the question of patients is, how do they work? Are they like a magic wand that treats problems? Well, this is how they work. Whenever there's an injury in your cell, any part of your body, it's like a flare gun. Like if you are in trouble somewhere, you're hiking and then you got in trouble and you're asking for help, and it's nighttime, you get a flare gun and it actually shoots the flare, and the people that will rescue you will see you, right? So our tissues are also almost the same. Whenever there's a damage, there are certain substances called chemokines and cytokines. They act like a flare gun. For example, let's make it simple. You cut your skin. After that, the chemokines and cytokines will now go to your bloodstream, and they will attract the stem cells in your bloodstream to go to the damaged area. When there's a cytokine release, it means that there's a damage. The stem cell will now attach to that one. So they get attracted by your flare gun. The process is called homing. It's like a homing device. No? They go to the damaged area with your cytokine and chemokine release. And then after that, your stem cell will now go there. It will look at the DNA of the damaged cell, and then it will replicate. After that, it will split again, look for another damaged part of the body. So that's how they work. They just go to the damaged area, repair it, then they leave. They look for another damaged area. Like I said, there's around 5 to 7 cycles for that to happen until they run out of 5 to 7 cycles. Usually on the 8th, 9th, and 10th, their damage is already damaged, so they become cancer cells. So the immune system will now eat them up and throw them out. So what's the benefit of even doing a stem cell treatment or a stem cell therapy? Okay. So like what we discussed, it's just an estimation based on the studies that were done that they found that from the time that we are born, we usually have around 200 million stem cells when we are in the fetal stage. And when we are born, it drops down to around 80 million stem cells. So as we get older, of course, if you're riding a bike, you fall, you get a bruise, you get like that. All of the damage that are happening, they eat up our stem cells. If you're a marathon runner, you're basically crushing your joints every time you're running. So when you're resting, your stem cells will now be used up also for that. That's why the advice is brisk walk, not running, for health. So you don't add damage to the body. Okay, so it will keep on going, and usually by the age of 40, we're down to around 35 million stem cells. Now the amount of damage is now more than the amount of repair cells that we have. So what will happen is now we don't mature anymore. We start aging because there's more damage to the body. So if patients would usually get treatments at a certain time of their lifetime, and you get a reinfusion of additional stem cells in your body, you're basically going back to the predominantly repair. The body will start repairing again, more repair. So you have to take note that as we get older, the body prioritizes. If it says, I don't have a lot of stem cells, what I will do is I will just use that for my vital organs. Your brain, your heart, your liver, your kidneys. It will now forget about your skin, your bone, your muscles. Because for the body, it's not as vital, right? So it will only focus on your brain, your heart. That is why the skin will eventually age. The bone will age. The muscles will sag, right? They will become flaccid. The skin will sag eventually. The bone will become brittle. But if you're able to increase the amount of repair in the body, then you can somewhat reverse the damage and reverse the age of the patient. So there are different uses for the stem cell treatment. One of them, of course, would be your spinal cord repair, because our stem cells can cross the blood-brain barrier and they can repair. This was actually proven by the researchers, and what they did is they added a low radiation tagging marker. They added it on the stem cells, and they infused it back into the patient, and then they did a scan of the patient. They found out that the stem cells go directly to the damaged areas. Patients with spinal cord problems, the stem cells go to the spinal cord. Patients with arthritis of the left hand, it goes to the left hand only, not to the right. Patients with liver problems, it goes to the liver, not to the other organs of the body. So that is how they were able to show that it actually works. So eventually, they would repair the cell and reverse the damage. Okay, one of the most common diseases also diabetes. So it creates the damaged cells in the body, and thereby creating additional pancreatic cells, and thereby creating new insulin. There's also stem cells for the heart diseases, and it was actually proven by the study done by the Federal University of Rio de Janeiro, where there's 30 million stem cells were isolated and injected into the damaged heart muscle. And 2 months later, the patients that had the treatment, you had fewer symptoms of angina and better blood flow. The damage got reversed. The other one is your joint rejuvenation. For patients, whenever we do the IV stem cell, it takes around 6 months for the stem cells to enter the joints because the joints don't have a lot of blood supply. So if the patient wishes to do a faster resolution of their joint issues, we do a direct injection of the stem cells into the joint, so it's faster. So after treatment, they did repeated scans, X-rays, MRIs, CT scans, and they actually showed the lining of the joints as actually recovering. Diabetes type 2 also, it's one of the first illnesses that were actually, conditions that were actually addressed by the stem cells. Even diabetic foot ulcers, they did direct injections on diabetic foot ulcers, and the healing is actually much faster, even for the diabetic neuropathy patients, which is almost difficult to treat. A lot of celebrities have already had treatments. And of course, if you pay attention, there's a lot of stem cell news that we usually see. These are one of the pioneer patients that have had treatments before. So this patient was Carl Franz. She had multiple myeloma, and they used the adult stem cells for treatments. Caitlin McNamara also had her bladder constructed using her own stem cells. So also other patients having degenerative diseases, they've all been treated. Now, please pay attention that I mentioned the word degenerative. So the reason is because stem cells are repair cells, which means that they only repair degenerated parts of the body. If the patient is an autoimmune case, then it is not for stem cells. If the patient is a cancer patient, then it is not for stem cells. If the patient is a chronic medical disease that is either congenital or from toxins, that is not for stem cell. It is only degenerative, the damages that are happening in the body. So many patients have been treated. So before I finish my presentation, the most common question of patients is, can I live forever? Who wants to live forever anyway? No, but if you look at Google, Apple, Microsoft, all of their biggest shareholders have now a lot of money, right? But they don't have a lot of time. So all of these big companies now allotted a big portion of their budget, and they're all now into anti-aging. They're now looking for ways on how to extend their lives. Because now they have a lot of money, but they don't have a lot of time. So they said, I need to buy time. So they want to extend their life. So the question is, can I live forever? As of the moment, we can slow down aging, but we cannot yet live forever. However, all of the experts in the field of anti-aging, they gave an estimation of around 10 years. With the development of the technology that is happening, in around 10 years, they estimate that we can already live forever. That is in 10 years. However, we still don't have that technology, right? So what you can do is, you slow down your aging to get to 10 years. And that's when we can live forever. But for now, we need to be able to slow it down first as much as we can. So you always see it in the news. Stroke patients, they actually improve faster. We saw that on patients. And even HIV, they tried it on HIV patients. Dr. Timothy Henrich of Harvard Medical, one of my mentors, he actually was the doctor that did that treatment. And they were successful at a certain point, but they found that they made a mistake on one of the procedures where they forgot about the hidden viruses. Like sometimes they hide on the gallbladder, and they were not able to. So now they're perfecting their procedure. In my patients, I see that around 9 out of 10 of patients, 1 year after, even their hair color comes back to their original color. So that's the ultimate sign that the procedure is working, which means that it's no longer just the vital organs that it is rejuvenating. Even the skin, the hair, the nails, the teeth, they go back to how they were when they were younger. And after usually one stem cell treatment, the most common question of patient is, how long does it last? Whatever repair it does, you will keep. However, the stem cells, like I said, has 5 to 7 cycles. So usually in around 5 to 10 years, they also disappear. Then patients can always get another treatment. So for my final message, stem cells usually give patients quality of life, right? It's not about living long. You might live 20 more years, but if you are bedridden for the last 10 years of your life, then that's not living at all. That is what we actually saw in patients. Like one of my oldest patients is a 94-year-old patient, bedridden. And after we treated her, we were able to extend her life and also the quality of life. So you see, we saw her walking, we saw her being okay again. So that is what we are after right now. Like I said, our point is not to live forever, but to increase the quality of life and to at least extend it. And if you're interested in living forever, then maybe you can wait for the 10-year period. So if you have any questions, we'll answer them later. If you are actually curious about the things that we do, you can search stemcells.ph. And if you have any questions, you can email me at doctor.com. Thank you.
Okay, thank you, Dr. Brian. And that was fascinating to look, a fascinating look into stem cells therapy, and it's clear that this field holds incredible promise for the future. Okay? So at this point, I would like to have a pause for our lecture. Instead, entertain some of the questions. We have given out some pieces of paper. Write them down unless you want a microphone to address a question to our topics. Speakers, we had so far 3 speakers talking on first hand. We have Dr. Lopez about don't wait, lose weight. Secondly, Dr. Ruby Magpantay about menopause. And the last one is Dr. Brian Tan about stem cell. So please give the mic to those who want to ask a question. Yes, sir.
Okay, I think my voice is loud enough.
All right, please. But we have a microphone so that the people on YouTube, or not YouTube, pala, Facebook Live, they can hear you.
Well, very interesting presentation on stem cells, and I like the way it's presented.
Yes, sir. Please identify yourself.
Yes, okay. I'm Dr. Francisco Wu from Bukidnon. I just arrived. I got invited by a newfound friend, Dr. Landrito. So I'm happy to be here. So it's like this. Concerning stem cell, I like the way you presented it. It was very informative, very intelligent, and with wisdom. I emphasize the third point because that's very important. You define the limitations, autoimmune disease, cancer, etc. And also what we expect from that. In other words, it's not challenging nature itself. We cannot alter nature because nature controls us. And I think anybody who violates nature is the first victim of that violation. Thank you for your presentation.
Wow, thank you, Dr. Wu. Like, all the way from Bukidnon. And we welcome you. I see a lot of new members of Prima from Cavite. We have the immediate past president of Cavite, my chapter of AFP, Dr. Shirley. Please be acknowledged, Dr. Padelia. Yeah, so we are inviting the whole family with family medicine into integrative medicine, diba? Okay. And next we have Dr. Wu, we have Dr. Kim, sino pa? Actually, I'm sure you are torn, no? Your hearts are, you want to stay here. At the same time, you want to go shopping, not there, but shopping here. Because we have 300 plus food exhibitors. Today is the only day that you can go around. So I'm not shooing you away out of this room, but this is actually a lay for room. You can watch our lectures. Recorded on Facebook Live from Prima Field. Okay po ba? But you can stay. But those who are torn, really, I want to get that nice bag also. You may go also. You have a 2 days. But the 2 days are limited for the more also excellent topics, no? Excellent topics for our medical conference for medical doctors. Anyways, so I have another question for Dr. Joel Lopez. Dr. Joel Lopez, there's a question from Mr. Paul Rojas. Right, ma'am. Yeah. Let me just finish this one. It's very short. Can you say something about metabolism boosters, doctor? Metabolism boosters. What other substances that you can initiate other than the chromium you mentioned before?
We've used different metabolic boosters such as L-carnitine, which is found abundantly in meat. So people who actually are vegetarians are the ones who usually gain weight because they are more into carbs. Recently, there's been an attack against the use of meat worldwide by the woke people. So yeah, it's important to have meat because it's not only important for muscle building, but it's also important for improving our metabolism. It's also good for our hormones. It's also good for other things in our body, such as enzymes. All these come from.
Thank you, Dr. Joel Lopez. We have any more questions? Yes.
Hi, Dr. Brian. Thank you so much for such a lovely presentation. I'm not a doctor. I'm actually an able manufacturer. So it was very impressive explanation. My question is, as you know now, there's a lot of peptide came out in the market. So, and with peptides and also with stem cells, there's a lot of contraindications, right? So now with peptides, especially with epitalon, and it became like taking over a lot of stem cell industry as well. And also like BPC and CGC. There's a lot of peptides that actually now came out in the market. It actually fixes more problem than the stem cells. What's your opinion about this?
Whenever you So, whenever we talk about stem cells,
No, mas okay pa kanina. Yeah.
whenever we talk about stem cells, we're not only using stem cells, right? We are getting different kinds of cells. The stem cell is your celebrity, it's your star, whenever we do those infusions. But if you take a look at what we call the stromal vascular fraction, that is the one that we inject back into the patient. That's where you get your exosomes even. Your exosomes are there, some peptides are also there. And the good thing about the stem cells is that they have the ability also to create peptides that we only use for that moment. Because if you take a look at the other peptides now, especially the famous ones for weight loss, they also have a high chances of getting thyroid cancers. Right? The difference between the non-synthetic stem cells that you are putting back into the patient is that nature has a way of knowing when to secrete and not to secrete, when to fix and not to fix. It's like getting your insulin injections, right? So you're getting an estimated amount of insulin into your body, but the body doesn't really know the fluctuations of your sugar. I mean, the insulin doesn't know. So it's just an estimation. But when your body is actually fully functional, your pancreas secretes the exact insulin that it needs to counter the sugar and puts it at the lower level. So there's a big difference between your synthetic peptides, exosomes, even especially the stem cells that they're claiming to be from either other animals or from other people. Right? And also, if you take note, the exosome technology is not yet perfected because also of the fact that we are still not sure of the potential diseases that we can get from other sources, right, from people. Remember, during the 1970s, there was a vaccine that was given in the US for most of the Americans. And 4 years after, they discovered that there was a virus that wasn't yet discovered at that time. And because of that, it actually gave a lot of cancer to a lot of patients after the introduction of the vaccine during the 1970s. So same as that, you'll never go wrong if it's from your body, right? Rather than getting it from other sources. So that's the big difference between the two. Yes, the peptides, the exosomes, they do a lot, but that's also part of the stromal vascular fraction that we infuse on the patient. Did I answer your question?
My question is also another one. As you know, we're now cell differentiating, right? So the telomere is actually getting shorter and shorter. But with the peptide, especially like the epithelon, you can increase the elevations of the telomere.
Yes.
So what do you think, like, we can stack up with epithelon and with epithelon and with stem cells?
Up till this date, there's really no actual research that we know that as we age, the telomeres shorten, right? And then we say, okay, but we can also lengthen the telomeres. But we are still, there's really no research that can really prove that by lengthening the telomere, you're actually also lengthening the age of the the life of the patient. It's like getting an old car, you restore it, doesn't mean that it's brand new, right? You were able to fix some of the other ones that you pre-painted it, you changed the other dents, you took it out, but it doesn't mean that automatically that you lengthen the telomere, that you basically lengthen the life. It's an observation that we found, that when the telomere shorten, we also age, right? The cells age. But it doesn't mean that if you're going to just reverse that problem, that you're going to, it's like the theory of evolution. It will forever be a theory because we can never prove it, right? Until someone can actually prove the telomere extension, then I would actually probably keep it. But for now, I don't usually go for the telomere extension. I go for the natural way. Get it from your own body, just put it back, and then it will repair. Thank you.
Thank you, Dr. Alan. Mr. Alan from Malaysia. We have a guest from Engineer Alan. Thank you, welcome. And for everyone watching on Facebook Live, we are on our lay forum of the Prima Medical Conference, talking about the healing revolution, the healing trends, the emerging trends about integrative and regenerative medicine. And we have one question from the audience. Can we read it?
Galing po sa... Sorry. I will not use my kaya naman ng boses. Galing po sa live natin from Miss Caroline Tanchi Pedro. When you have stem cells in the fat, if you exercise and burn fat and release that, would you be able to utilize the stem cells in the fat that way? For Doc Brian po. And watching and listening from Hong Kong from Ann Benologa.
Wow, we have international listeners, no? Watchers. So that's from Dr. Caroline.
No, the answer there is no. Even if you exercise, you're basically only making the fat cells smaller. So we have to remember that tissue, adipose tissue, or the fat cells are only storage of energy. Which means that when you eat more energy in the form of sugar, the fat cell enlarges. It doesn't actually multiply. Even the stem cells that we have, they're already the actual amount. We don't multiply them in the fat cell. And they are trapped in between the cells. It's very difficult. It's usually either you do a mechanical or an enzymatic reaction in order for you to release the stem cells. So just by burning the energy and making the fat cells smaller, it will not release the stem cell into the bloodstream. However, it will increase your blood circulation. And if you have existing stem cells that are still circulating, then they can get to the area that they need to fix much, much better than if you live a sedentary lifestyle.
Thank you po.
Thank you.
Thank you. Thank you, Dr. Tan. We have more, ma'am?
Okay.
Oh, again, yes, Dr. Alan.
Okay. It's like
Maraming
this,
Dr. Alan.
Well, very interesting part, of course, is it costly? Okay, I already. Well, if it cannot be answered publicly, that's fine. Okay. Yes.
I remember the commercial, I think, of Ms. Aquino when she said it's actually sulit. Right? We've seen so many patients on their deathbed asking and saying, I'm going to give everything that I have just to get 1 day extension. Some of them might say, 1 week. If I can only have 1 week, I'm going to give everything. The answer is we don't need to get everything. We only need to get a portion of that in order for them to get their stem cell treatments.
So how much?
Per patient, it's different. So what we do is we make an assessment on the patient. I had a patient who is one of the famous basketball players that eventually died. Before he died, he went to me, and then his condition is cancer. And then he told me, I want the stem cell treatment. I don't care how much it's gonna cost. I want it to be done now so I can get rid of my cancer. I had to say no. I said, it's not for cancer treatment. I said, there are other treatments that we can do, but not stem cell for cancer. So, it depends. One patient will always vary. We've even had patients that came to us and said, I want this treatment. I want the stem cell treatment. And apparently, it's as easy as changing their diet and it actually corrected the problem. So I even had one patient who has a diabetes type 1. And the diabetes type 1 patient said, I want stem cell for my, as a treatment. I don't tell the patients, yes, let's do it today and let's do it tomorrow like that. I don't. I will assess the patient, and if they don't need it, and if it will not work for them, I will tell them outright. for this diabetes type 1 patient, I said, you know what, there's another research that came out that if you do your BCG vaccine, it might actually help reverse the type 1 diabetes. Would you like to try? And then the patient said, okay, if it doesn't work, let's do stem cell. I said, yes. So we did the BCG, and it actually reversed the type 1 of the patient. How much is a BCG vaccine? That's very, very cheap, right? If I wanted, I could have told the patient, let's do stem cell, right? But if the patient doesn't need it, I'm not gonna push it to the patient. Only if it has a role, and only if it actually.
So how much?
Now, per patient, different things that we need to do. We also combine it with other treatments. So, if for example, the patient has a lot of toxins, you don't want to give the patient stem cell and you're repairing, but you're letting the damage continue. You need to stop the damage also, so that you're not repairing new damage. You need to stop the current damage and then repair the old damage. So, yeah, but per patient, we have different rotations. That's why we always have to see the patient